Hi, I am Bo Whitaker. I'm a veterinarian at Brazos Valley Equine Hospital in Salado, Texas. I'd like to talk to you today a little bit about the Larc test, about some of my experience using the test. I was introduced to it probably 4 or 5 years ago at a rehab center that I work at once a week. I also met Cecilia Tula, who is the exercise physiologist and veterinarian who created the test. What this test does, in just kind of a nutshell, is it looks at recovery utilizing a heart rate, respiratory rate, and lactate measured at 0 minutes or immediately after exercise, and then 30 minutes after exercise. And so, like a lot of things, immediately I was a little bit skeptical as to, exactly how accurate the test was, what I could gain from the test. So we started using it at the rehab center that, like I said, I go to once a week. And I really started seeing a lot of really benefit to the test from a diagnostic standpoint. Um, so how the test works is you exercise the horse. Typically, you want to have the horse doing some kind of maximal effort. So we do a lot of barrel racing horses. There is an arena at the rehab center, so oftentimes what we have horses do there, if they're barrel horses, we'll go have them run hopefully a maximal effort barrel pattern, and then we'll do the test immediately after. We've also done quite a few of these at barrel races at competitions. We'll also sometimes put horses on the equicizer and work them pretty hard on an equicizer. You could also work a horse on a lunge line. We've also had some horses that just were ridden, loped in circles, things like that. But you do want the horse to make sure they're getting some kind of maximal effort in order to get accurate readings from the Larc test. Once you plug those values into the test, the heart rate, respiratory rate, and lactate, after the 30-minute mark, you get a feedback on a software that was developed. And what it does is it gives you several readings and markers that it's a kind of a survey of the horse using the recovery parameters to help me key in to areas I want to go into further if that horse is having performance issues. So one of the things that we see on there is a pain indicator. And so when I see a pain indicator, we'll typically do a lameness exam on the horse. I would say over 50% of the horses that we evaluate that have a pain score will have a grade 2 lameness or greater. We've also had pain scores from severe bleeders, so horses like where you just got blood pouring out of the nose, we will get pain scores sometimes from that. We also had one horse with anhidrosis. That was kind of a neat case that showed a pain score. That horse was having performance issues, but it was very sporadic. And one of the readings on the Larc test that we get, it gives you a temperature and humidity reading. And so over successive Larc tests, we're able to figure out that horse was becoming anhydrotic above a certain level of humidity independent of temperature. And so we're able to track the Larc test and look at recovery and able to diagnose that horse based on the temperature and humidity readings and the pain scores that we were getting on the days that the humidity was over a certain level. So that was a kind of interesting case. You also get a bleeding score on these horses, or a bleeding alert on a score. So on those horses, we'll typically want to do a upper airway endoscopy and or a BAL, depending on the results of the scope. Once we get those bleeding alerts, I've found the bleeding alert to be very accurate as far as diagnosing which horses are having EIPH. There's an airway alert that we get, which is basically kind of an airway obstruction. And so in those horses, oftentimes we'll do scopes, do mucus scores, septum scores on those horses, or look for other reasons for airway obstruction. But typically most of those horses that we get those alerts on are going to have mild to moderate equine asthma. We've done BALs on many of these horses, probably I think 20 to 30 of those horses we've done BALs on, following up on the Larc test results. And it's been very accurate in diagnosing those horses that have mild to moderate equine asthma. You can also get a risk of injury alert. So on some of those horses, we may run a CK or AST to make sure those horses don't have PSSM or some kind of other muscle disorder, genetic muscle disorder. We've had one of those horses as well, actually the same horse that had the anhidrosis, that we ended up doing a cardiac workup and found some arrhythmia in that horse as well. So it's been very, very influential for me as far as horses with just mild, poor performance that we really can't pinpoint any one thing. And what the Larc test has really been able to do is help steer me in the direction of where to start looking and what diagnostics I need to perform next in order to figure it out. We had another horse that was a barrel racing horse that just the time started decreasing the horse. This is a really upper level barrel horse, 1D horse that was winning a lot of rodeos, and the horse just started to lag off and really couldn't figure out why. So we started doing Larc tests on the horse, and what we ended up figuring out on that horse was we were getting some airway alerts initially, and then after that, the airway obstruction, the equine asthma the horse had eventually caused the horse to bleed, and then at that point we started getting bleeding alerts on the horse. And we did BAL. We're able to diagnose that horse based on the BAL, thanks to the Larc test readings that we got, and treated that horse, and that horse is really doing great now. So some of the key takeaways, for me, it's a subclinical pathology indicator. So some of these horses aren't performing poorly, but you'll get readings on some horses before you actually see them starting to lag off, and so you can intervene before that horse has issues. It's also great for just at the rehab center. We use it a lot on horses that are going through rehab, and to see when those horses are ready to increase intensity, or maybe we need to back off on those horses, and so we don't risk re-injuring them. So it's a really great guide as a maintenance on those horses to regularly check if the exercise intensity is appropriate. One of the good things I like about the test is I don't have to do it myself. I can just get the readings. And so we have a certified person at the rehab center, and also one of my technicians is certified to do Larc Test. And so at competitions, at barrel races, oftentimes my technician will go. I don't have to be there because she runs barrels, so she'll do a couple horses at the barrel race and then send the data to me, and then I can follow up on anything that might need to be followed up on. We tracked over 100 horses last year that we did Larc tests on, and tracked also the diagnostics that we did afterwards. And for every horse that we tested, we came up to about $220 of secondary income off those horses that were triggered by things we found on the Larc test. So that figure included diagnostics, so BALs, endoscopies, radiographs, lameness exams. I did include joint injections in that, but I did not include treatments for respiratory issues or other things. So that's probably not the total income, but it was at least the diagnostics and joint injections like that we would get off the pain score, for instance. So now I'm going to turn the rest of it over to Cecilia Tulia, who's the creator of the Larc test. She's going to go in kind of the nuts and bolts of the Larc test, how it works, some of those things as well. So if y'all have any questions, be sure to call me or email me. I'll be happy to talk to you about the Larc test.